Welcome to Healthy Heart. This is Dr. Isaac Opoku-Asare and his production team, Mr. Blay, who is coming to you this evening once again with very important discussions about your cardiovascular. It's not only cardiac, it is cardiac and vascular because there is a relationship between the two of them. And if you were with us the last time, we talked about the various blood vessels that are in the body. Why is that important? Because for certain people, any problem that they have pertaining to the blood vessels, they consider it as a vein. I've heard a few people talk about the arteries, but the arteries are different from the veins and also different from the lymph vessels. They all carry very important functions for us to enable us to be able to enjoy our lives and have ideal cardiovascular health. So I hope you go back and listen to those ones, and I believe that is going to help you. We will continue that discussion today. There are a number of things that we'll be talking about pertaining to circulation, and we'll talk about the blood vessels, and today we'll be talking about the veins, at least. We'll be talking about venous insufficiency. If you ever met a vascular doctor, you're going to hear that word. That means that the veins are not doing what they are supposed to do, and that is causing problems for you. We call it chronic venous insufficiency. In a simplistic way, I will just say that leg vein insufficiency. We don't put it that so that it makes it easier for you to understand. The discussion on vein is really broad, and we'll take our time and come back to you to have further discussions about the other forms of vein pathology. But we talked about the fact that the veins, the work that they do, if you go back and look at the discussion that we had, the work of the veins is that they take blood from the body to the heart. The work of the artery is to take blood from the heart to the body. So if you consider your legs, which we'll be talking about today, the arteries of the legs are the ones that carry the blood that contains the oxygen and the food that you eat, and they bring it to the leg. And then once the muscles of the leg, they end up taking the oxygen and the nutrients out of the blood. It goes through the capillaries, and then it is the work of the veins to be able to take the blood back to the heart. And the problems are different from the arteries compared to the veins. We talked about the fact that because arteries, the force in them is generated from the heart. Because the left side, the left lower chamber of the heart, which is called the left ventricle, is pretty powerful. It's able to force blood and get it through. Generally, clots do not form in your arteries. Rather, it's a plaque, because this is a mistake a lot of people make. Whenever you are talking about arteries and you're saying that there's a plaque, go back and look at all those things that we talked about. A plaque is different from a clot. Plaque is what tends to form in our arteries, whereas because the blood flow in the veins is slow, clots tend to form in the veins. So these are two different things that happens. And the goal is that the vein should be able to get the blood back to the heart. That is a very important thing. So we're going to talking about what happens. What is the problem with the veins not being able to take the blood back to the heart? And we'll be looking at that. But before we go on and do anything as we do, before we do our discussion and give you the opportunity to invite somebody to join us, we want to go through the 7 pillars of ideal cardiovascular health. This is something that you just cannot, I'm going to say it over and over and over again, that this is something that you just cannot decide not to do them, because they are the pillars of good cardiovascular health. It affects the heart, it affects the blood vessels, it affects virtually everything. I mean, even the vein condition that we're going to talk about, it affects it because it's part of the vascular system. And that is why it is important for you and me to be able to always remind ourselves about the 7 pillars of ideal cardiovascular health. And then we'll go for a short break and come back. So what are they? The three most important ones, in my opinion, is physical activity. Physical activity means that it is not a work that you do. You need a leisure time. That is a time not that you are not working, to walk. Just try to walk 150 minutes a week. We'll break it down to 30 minutes a day for 5 days. Or I tell people that if you can break it into 3, walk for an hour every other day, that is going to work. And if you're somebody that jogs and run, what you can do is you can jog or run or swim just an hour and a half, and you've got your knees to have ideal cardiovascular health in that respect. So physical activity, very, very important. Avoid sedentary activity. That is sitting down repeatedly for 8 hours is not good. No, we don't like that. We have all these videos online. I strongly encourage you. They are all available on YouTube. So you can invite somebody to join and to be able to listen to them. These are very important things that we need to pay attention to, and it's available for you for free if you were able to go there. So the second thing is controlling what you eat. Dietary discretion, right? It is important for you to avoid refined sugars, avoid trans fat, reduce your it is important to reduce your saturated fats. That is the fat from animals, the fat from the cheese and all those things. And it is better to switch to poly or mono unsaturated fat, which are the extra virgin olive oil and all the vegetables oils are there. Fat is not bad. I'm repeating this. You need the fat to form the cell wall or your cell wall. It's an integral part of your body, and you cannot avoid fat. It is important that you eat, and there are good fats out there, and they are the poly and the mono unsaturated fat that you should have. So a diet that is high in vegetables, high in fruits, and good amount of fish and nuts is what we will recommend. And a lower level, I'm not saying avoid, and a lower amount of red meat, especially avoiding processed red meat, is going to help you in a very long way. So today is not a discussion about dieting, so we want to move on here. And the third thing that we'll talk about is controlling your weight. I always say controlling your calorie, because I've never seen anybody fast and grow big. If you are fasting and growing big, there is a problem, because anybody that tends to control your calorie, you'll be able to manage your weight. So if you measure your belly button area, the measurement around your belly button, and if you're a man, and that is more than 40 inches, is something that you need to pay attention to. So the 3 key principles here that we all need to pay attention to is a physical activity, appropriate dietary patterns, and controlling of your calorie and your weight. I put them as together. Then the fourth one will be avoidance of smoking, whether primary or secondary smoking. When you're able to do this 4, then the other ones will follow most of the time. Even if you're taking medications, it makes it better. Controlling your blood pressure by ensuring that your blood pressure is less than 120/80. If your blood pressure is less than 130/80, I will take it. If you're more than 80 years and your blood pressure is less than 140/80, I will take it. Because elderly people, it becomes a little bit of a challenge in respect to that. Then let us talk about the other ones. Is appropriate level of your cholesterol. That is a discussion that is that we've already done on several occasions, and I think that you can go to our YouTube and look at all the videos out there that were presented. So the goal is that your total cholesterol should be less than 200, but there are more details into that. I believe that cholesterol it should be tailored to everybody, who you are and the risk factors that you have. But ideally, the bad cholesterol should be less than 100. And if you've had a heart issues in terms of blockages, it should be less than 70. And people believe that it should be less than 50, in my opinion. And the other thing is your blood sugar should be your fasting blood sugar should be less than 100. These are very important and critical things that If you're able to do them, they'll go a very long way. I strongly recommend, especially to the men that are listening to me. And if you're a woman that are listening to me and you have a husband, it is important that at least once or twice in a year, you check these 7 critical indexes of your life. I mean, even for the young people, I believe that it's important that these things are checked. You need to know your cholesterol level. You need to know your blood sugar level. You need to know you need to also know your blood pressure. These are important for you to know. It is not good all of a sudden to hear that a 50-year-old, a 60-year-old all of a sudden fell sick, and then when you go into it, realize that you never saw a doctor, you never did this. One of the things about cardiovascular disease is that it does not creep up on us. I'm repeating this. Most cardiovascular disease takes around 20 years to develop. For you to have a blockage in your heart, it takes a minimum of about 30 years for that to be able to happen. So the whole idea that it came upon me all of a sudden doesn't really apply. So sometimes people talk about, oh, okay, I was able to go through this and survive it, but you could have avoided it. Prevention is better than cure. And an ounce of prevention is better than what? A pound of cure. So that is why we have this program, to be able to help you. And we'll reinforce this over and over and over and over again. If your BMI is more than 30, please pay attention to that. That means that if you divide your weight by your height and it's more than 30, that is a problem. You need to work on that to fix it. And that is why you need to control your calorie to be able to bring you to less than 30 and ideally less than 25. Getting less than 25 is pretty tough, but less than 30 is a very doable one, and you'll be able to do it. So we'll go for a short break and we'll come to our discussions today. Very important. We're talking about the leg vein circulation issues, which doctors call chronic venous insufficiency.
This is Zoe Light Radio.
Welcome to Advanced Cardiovascular Institute and White Oak Cardiovascular Center. This is a place that you can be assured of evidence-based, patient-centered, and compassionate care. What does it all mean? It means that when you come to Advanced Cardiovascular Institute and White Oak Cardiovascular Center, we do not see you as a patient, but we will see you as a member of our family. Therefore, we treat you the same way we treat our family members. That is why at this place, we have taken measures to make sure that you are being treated with the highest care and, more importantly, with people that are qualified to do what they are supposed to do. If you look at our rooms, you realize that we've made room for any condition, including whether there is a pandemic or not. Additionally, we also see that we have a staff that also cares for you. So, as you come here, we don't see you once again just as a patient, but we'll see you as a family.
This is Zoe Light Radio.
Thank you for joining us once again. Today we're talking about venous insufficiency. And specifically, we'll be talking about chronic venous insufficiency in the legs. So as we talked about earlier on, the blood flows from the legs to the heart. And if you see this picture, you're going to see how a normal vein and an abnormal vein is. And it is the picture that is on your right, where you see that, and in a normal vein, the blood flows up, and there are valves in the vein, which when they close, they prevent the blood from coming back. So that is why those valves are. You know, God is the master of our lives. Let me put it this way. Everything in the human body has been carefully done to ensure optimum function of it. So the valves over here allows flow in one direction. So if you look at the picture again, you're going to see that the valves allow blood to flow up. And that is how they are able to, once they cross one valve, they do not have the opportunity to come back. They have to go to the next, to the next, to the next, till they reach the heart. But as a result of many other factors that we're going to look at, including obesity, Obesity is a huge factor. Obesity and sedentary lifestyles and other factors that come in here. You will see that on the same picture, you see the normal vein, and you're also going to see that there is another vein over there that is diseased. And you realize that it has sort of ballooned out one way or the other. And instead of the blood going straight ahead into going straight ahead all the way into the right side of the heart, part of the blood comes back. And that part of the blood that comes back is what causes the venous insufficiency. Why? Because sometimes people think that the insufficiency means that, okay, it is not there. In this case, it's not working appropriately because the valves, because the blood vessels, you realize that here the valves are close to each other. But in this case, the valves are not close to each other. The valves, if you look at the picture, I'll bring it back to you again. You're going to see that the valves are not touching each other. So it allows the blood to come. And that is one of the reasons why people's leg, they swell up. Because instead of the blood going to the heart, the blood comes down. And you see the picture of the person that is on the other side. All the veins that are popping out, just look at it. The veins are popping out because if you look at the disease vein, the veins are what? The veins are popping up on that person's skin. You could see it because that is exactly what is happening. At the level of the vein itself, where they are what? They are seem to be bulging out. And so one of the major reasons why people have venous insufficiency, that means that the veins are not working. And these people have swelling in their legs. It's not only swelling in their legs. That is a manifestation of that. Is the fact that the valves are incompetent. They are not able to do what they are supposed to do. So this is more or less a simplified version of the pathology. That is why we have this situation.
This episode is sponsored by Zenith Christ Family Chapel. ZCFC is a scripture-based church located in Spencerville, Maryland. Join us every Sunday in person or live on YouTube at 2:30 p.m. Eastern Standard Time. God bless you.
It can also occur as a result. This can also occur as a result of the fact that sometimes when you have a clot going on in that area, on top of the valves, it can end up destroying the valves. And at the end of the day, that can lead to problems. So what are the causes? What are the causes of venous insufficiency, especially in the legs? And we're going to show you this picture. This picture is sort of one picture that describes virtually all the things. What are the causes? You see, some of them are genetic. There's no doubt about it. These are something that you cannot avoid. But I always tell people, if your mother had varicose veins or a family member of yours has a varicose veins, then you have a very high tendency of having the same thing in you. So there is a genetic component. People who do work, prolonged standing, and I've seen this a lot in nurses, right? Venous insufficiency can be pretty common in a lot of people whose job demands that they stand for a long time. If your job demands that you stand for a long time or you sit for a long time, then ultimately you are reversing the natural principle about how veins work. The way that the veins don't have any pump. The pump of the vein is the muscles. So the muscles have to pump as you walk, as you move about. The muscles, they squeeze the blood and move the blood up. So long periods of standing is one of the reasons why the veins become incompetent. That is, they are not able to function the way they were. So if you sit for a long time, and if you stand for a long time, it's not good. Once again, this is one why we always talk about the pillars of cardiovascular health. A sedentary life is never a good life. I'm repeating this. So you see the long periods of sitting down, watching TV, people watching TV in a one place for a very, very long time, then your legs swell. And that is why when people travel, sometimes when people travel long distances, One of the challenges of traveling long distances in a plane or anywhere without walking is that as you stay there, the muscles are not working. That's why we encourage people that even once you're sitting down, begin to move the legs. Why is that important? You are making the muscles work, because if you keep it staying in the same place, whilst people are traveling in aeroplanes and other things, because they are staying in the same place and they are not moving the legs, not only aeroplanes, other places, you can end up forming a clot, and the clot can move from the veins, go all the way to the lungs, and the clot can go end up in the lungs, and it has resulted in people dying as a result of this. So it is critical that whenever you are in a situation that you are sitting for a very long time, it is important to move around a little bit to get the blood pumped up by the muscles for them to be able to go. So look at a person with a normal blood vessel, a normal vein, and somebody without a normal vein. We're going to show you the picture very soon and highlight that particular one. You see the normal vein over here, and what? And an abnormal vein. That abnormal vein is all twisted, and that's sometimes how you see varicose veins in people. It's all twisted and wiggly, and that is some of the reasons. So long periods of sitting and long periods of standing is not what? It's not something that you should encourage. Always move around, get the pump going. And this is one of the reasons why even young recruits, even in military, young military recruits, some of the people, if they stand for a very long time, they pass out. The reason why they pass out is because the blood is pulled into the legs. And when the blood is pulled into the legs, the blood is not going to the brain. They have to be vertical so that the blood can go to the brain. And you see the picture over here, obesity, right? It is when you are obese, sometimes, it's not sometimes, in people that are obese, especially with truncal obesity, that means that a lot of the belly, and I talk to the men a lot, there is no reason for a man to be pregnant, right? There is no reason to have this big belly. You need to work on them. What it does is that it exerts a lot of pressure on the veins in your pelvic area. And because there is not a lot of force in the blood vessels that is going through the veins in the pelvis, the abdominal obesity can compress on that. And instead of the blood going through the veins and going up, they go back. And that is why obesity is one of the issues. Another thing that you also need to know is pregnancy. Pregnancy generally, because of the pregnancy, it can exert a little bit of pressure on the blood vessels in the veins in the pelvis, and that can also do that. And that is why it is important that when women begin to see the signs of venous insufficiency in them, it is important to pay attention to them, because this is one condition, if you see it, it affects a lot of women, because as a result of even pregnancy, they can end up with venous insufficiency, and that is something that you need to pay attention to and make sure that it does not progress. Welcome to Advanced Cardiovascular Institute and White Oak Cardiovascular Center. This is a place that you can be assured of evidence-based, patient-centered, and compassionate care. What does it all mean? It means that when you come to Advanced Cardiovascular Institute and White Oak Cardiovascular Center, we do not see you as a patient, but we will see you as a member of our family. Therefore, we treat you the same way we treat our family members. That is why at this place, we have taken measures to make sure that you are being treated with the highest care, and more importantly, with people that are qualified to do what they are supposed to do. If you look at our rooms, you realize that we've made room for any condition, including whether there is a pandemic or not. Additionally, we also see that we have a staff that also cares for you. So as you come here, we don't see you once again just as a patient, but we'll see you as a family. We'll come back to this picture, but this picture shows us that probably 1 in 2 women may have some venous insufficiency, and probably 1 in 3 men. So this is an extremely common condition It's a very, very, very common condition. It's found in many, many, many people, just that they do not know. And I have had the opportunity and the privilege to be able to educate patients that were sent to me for something that is totally different, and they did not even know that they had venous disease, because it's not something that is looked at by non-vascular doctors. But I believe that for us in vascular medicine, it's important for us to examine your legs, feel the pulses, and look for these things that are over there. So what are the signs? When we're going to go through some of the signs of venous insufficiency. One of the signs that you're going to see, what are some of the symptoms that patients have? Some of the symptoms, people give it this name, hashi, but let's go through them. Some of it is heaviness in the leg. Heaviness. And they realize that when they lift up their leg, that heaviness goes down. Thrombing. This thrombing feeling in the legs. Numbness in the legs. Tingling sensation in the legs. All of them are maybe signs of venous insufficiency. Because why? That the blood in the vein, it does not contain oxygen. So the more they get stagnant, the more the leg is not getting enough oxygen, and they can produce some of these symptoms that you are having. So I'm talking about heaviness. I'm talking about aching. It's not really sometimes pain, but it aches. You cannot put a true description on that. In addition to that, you also have to know that apart from these symptoms, you can also have swelling of the legs. You can look at, we're going to show you this picture, a picture of somebody that has got a swollen leg. But let us look at, before we go to the swelling, let's look at this picture of this individual. They are holding the leg because the leg is, we're going to show them a picture in a few minutes. The leg is aching, and because the leg is aching, and that is why, there's another picture, we'll show you another picture here. The leg is aching, and that is why this woman is holding the leg. She has not developed advanced venous disease though, but it's because of the pain and this uneasy feeling, numbness, tingling, thrombing that is going on, that is causing them. And on the other side, you see the person having varicose veins. So whereas you see varicose veins, so pain, aching, thrombing may be what you see. And then you see varicose veins, and varicose veins is a manifestation of the fact that the patient may have a valvular incompetence, may have the fact that the veins are not working properly and the blood is coming back. Other symptoms that you can see is also swelling of the legs. Swelling of the legs, which if it's not controlled, can ultimately lead to an ulcer of the leg. And most ulcers of the leg, I'm going to repeat this. If you see somebody with an ulcer of the leg, the commonest reason for an ulcer in the leg is due to a venous disease. I'm telling you, it is known to probably account for 70% of all the ulcers in the legs. Arterial disease accounts for probably a lesser amount, around 20 to 15%. And the other ones are pressure ulcers and diabetic ulcers and a few other ones. But the beast, the monster in the room when it comes to why people have ulcers on their legs is venous disease. And it's because the veins are not working well. A lot of people do not know this. And that is why it is important that as it is important for you to recognize this very early, irrespective of your age, and ensure that you do not progress as the venous disease does not progress. So we're going to show you a picture. We'll talk about the beginning of where there is no swelling. All that you are having is aching, thrombing, that you are having. And you have no problem as at that time, because most people do not even realize that that is a vein disease. But that may be the beginning of a vein disease, and simple things can go a very long way to control it. So we're going to show you a picture of the vein, of the various stages that venous insufficiency goes through. So the first one that you're going to see, so they are named as stage 1, stage 2, stage 3. As you can see the picture over here. So stage 1, all that you're going to have is spider veins. Those are small little. We want to keep this picture on for, because it's a very, very, very important picture for you to be able to see. So what do you see here? The picture that you see here is the stage 1, which a lot of people have. is that there are small veins that you have, no big ones. And then it moves on to become the reticular varicose veins, which everybody sees. And most people go after it, sometimes for just cosmetic reasons. It is good that you take care of it for the cosmetic reason. But more importantly, it is good that you take care of it to prevent the progression of the disease. And there are very simple, inexpensive ways to be able to take care of this to ensure that it does not progress. Because beyond a certain level, the simple measures will not be able to get it done. And then we go to the venous nodules, where now things begin to happen to you, and you've now moved from first stage of just those ones there, then you go to the varicose veins. Actually, the third stage over here, which they are not depicting well, is swelling. Once you get to swelling is the third stage. Then when you go to the fourth stage, you realize that the skin color begins to change. So a lot of people, their legs swell and it goes back. Their legs swell and it goes back. When they sleep, the swelling goes back. When they wake up, the swelling comes up. That swelling on and off will cause the skin to start changing. And generally, the change in the skin is where it gets darker and darker and darker. And if you do not do anything about it, you end up with ulcers. So it is very important. This picture is sort of a little bit, the stages are not very clearly defined because it's sort of an old thing. But to make it simple for you, the first stage will be all those ones aching and the other thing that is going on. The second stage clinically will be where you have the varicose veins. The third one will be where you have swelling. And the fourth one will be where you have the skin changes. Now your skin is getting dark. And if you don't take care and if you don't fix it, ultimately you lead what? To an ulcer. Once again, when you see somebody with an ulcer in the leg, 7 out of 10, it is due to a vein problem. It's not coming from me. It's based on the articles published in New England Journal everywhere, showing that the commonest cause is a vein disease. And that is why if you take care of it early, it's going to help you. So if you have any swelling in your leg, it is very important that you either talk to your doctor about it and make sure that that has been assessed, because most of these things are not just because, as I've told you, it's not just because the vein is not the main causing factor. The problem may be coming from things like, I said, obesity. Losing weight is going to help cut it down. So other things that can also cause the legs to swell and cause pressure in the veins is if you have a heart failure. If you have a heart failure and the heart failure on the left side is affecting the right side, that can also cause that. If the pressures on the right side of the heart coming from a lung disease get prolonged, ultimately the pressure backs up from the right side of the heart and it always ends up in the leg. So why is that important? If you have your legs swell on and off, it is important to talk to a vascular doctor, or talk to a cardiovascular person. I will say, contact a cardiovascular person, or have a discussion with your doctor. At least I'll say that, have a discussion with your primary care doctor about the swelling or the aching of the legs, and it may be important for you to be referred for somebody to look at it, because I believe that at the very early stages, it will not demand much to be able to take care of it and take care of it well. Once some basic workup is done on you to find out what is causing it, you can most of the time control these ones with very minimal therapeutic approaches that will not demand a lot from you. So let us look at, we'll come back to our picture again here and we've talked about the causes. I said the cause could be obesity, the cause could be sitting down for a long time. All those things can end up damaging the vein, and then you can have the various manifestation. So let's talk about how to fix it. Today we are talking about the vein circulation in the legs. How do you fix it? We'll go back to our first picture that shows it gives sort of a global idea of venous insufficiency and everything. You realize that the basic thing that you can always start with, without doing all the big thing, is that after your doctor has done a few tests, if there is a swelling in your legs, the doctor needs to make sure it's not coming from the heart. So sometimes it may be good for them to do an echocardiogram to make sure that there is nothing. They will do. They can also do an ultrasound of the vein system in your legs to make sure that it helps us to make sure that there is no clot in the legs, and it also gives us an idea whether the valves are incompetent, because if the valves are incompetent, the blood, instead of going forward, the blood will come down. So having done these sort of basic, in my opinion, a few blood tests, an ultrasound to look at the vein systems, and if you're having shortness of breath or something like that, also to look at make sure that it's not coming from the heart. If at that point that we think that it is coming from the valvular incompetence, that is, the veins are no longer able to do that, the first thing that probably is recommended, is not probably, the first thing that is recommended is the use of compressive stockings. I cannot overemphasize that. Because sometimes certain patients think that you can do all the big thing and you don't need compressive stockings. Even when those things are done, you still have to be able to wear the compressive stockings. Compressive stockings, in my opinion, should be medically prescribed, as I do. I do never tell a patient to go and buy compressive stockings. It has to be measured and it has to be prescribed. And I strongly encourage that you see either a primary care doctor that is good with venous disease or a vascular doctor that can appropriately determine the level. Let me give you a story of a patient that I met recently. This is a patient that was having swelling in his legs. And so he saw a particular individual and the person prescribed compressive stockings. So the guy went out there to buy compressive stockings. After buying the compressive stockings, the guy's foot, he started turning blue. You know why the guy's foot started turning blue? Because the doctor that recommended the compressive stockings did not know, I believe that genuinely did not know, that the patient also has a blockage or a reduction of the arterial flow. So if the blood that is coming to the leg through the arteries is compromised, the compressive stockings may further compromise that flow. And that is why generally in my practice, I do not put compressive stocking on anybody unless I've ensured that the arterial flow is appropriate. So when the patient ended up coming to me, I could see that the patient was visibly disturbed because the patient went to see a foot doctor and the foot doctor said, you have to see a vascular doctor as quickly as possible. So when he came to meet me, I said, let me tell you, the biggest problem is the compressive stockings, because the compressive stockings was placed on you without first checking that the blood circulation in the arteries is appropriate. So I just asked him, there is no need to do anything. Please go home, relax, have a good time, and then come back to us. When you come back to us, we're going to have a discussion, and in that discussion, we will then discuss how to fix the reduction in blood flow in the arteries, and then we'll come back to the veins. So he gave me a call. Do you think he's going to be all right? I said, yes, wait and see. Because I believe that compressive stocking should be medically prescribed in the appropriate patients. And if you do that, it works very, 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 very well for the early stages of venous insufficiency disease. In my opinion, and I believe in line with all what insurance companies and the guidelines will recommend, every patient should at least try 3 months of compressive stockings if they don't have arterial disease. When they have arterial disease, then I will rather recommend the arterial disease must be addressed. After the arterial disease, then we will end up going back to the venous disease. The other forms of treatment that are available, which we will show to you, is what we call ablation, or some of them are called ablation, where you see this picture over there, where we come in and the blood vessel that is being popped out, we close those veins to allow the blood to go through the deep system. So we call them ablation. There are various ways to address closing those veins, so that those veins, once we close those veins, the blood will go through the appropriate channels and it's going to help you. But it all starts with compressive stockings, and then from the compressive stockings, we'll do the vein ablations. And beyond the vein ablations, we can also close the veins with other approaches that are helpful. But we'll have a totally separate discussion. Today, I already touched on the compressive stockings. We'll come and do a discussion on various treatment approaches for venous circulation, venous insufficiency in the leg. But for everybody, at least the early stages, very early stages, where there's varicose veins and other things, it will strongly recommend that you need a medically prescribed compressive stockings to start with. As the disease progresses, the compressive stockings will not be able to get it done, especially when the swelling is pretty significant, or when you have the skin changes already going there. You, in that situation, will need something beyond the compressive stockings to be able to help you in the form of ablation or sclerotherapy or other forms of treating the veins. In that situation, you need the veins to be treated, and that's going to go a long way to help you. Come to the end of our session on the various, going to a session on the vein insufficiency pertaining to the legs. And today we just talked about the disease manifestation, and then touch a little bit on the first way to manage and watch the compressive stockings. We'll come back to you with the various treatment modalities, in greater detail. But as we started with, you realize that even in the cases of vein disease, the pillars of cardiovascular health, in this case, your weight and exercise. I told you the three things: weight and exercise, or active lifestyle. They play a critical role. And that is why we always want to remind you that make the numbers better in terms of cardiovascular health, and that will go a long way to help you. Please call other people to join to listen to us. Also go to our YouTube channel and subscribe to it. View the videos that we have. Send your questions to us, or you can put your questions out there, and we'll do well that when we come back, we'll be able to answer those questions before we proceed. God bless you, and God bless America.
Thanks for listening to God's Rhythm. Tune in every Monday and Thursday at 10 a.m. Eastern Standard Time to learn how to protect your heart. God bless you.